Hello, everyone. Welcome to this week's COVID-19 Housing Provider Sharing and Problem Solving session. Thanks for joining us today. I'm Torlin Wimbush from All Chicago, and I have my colleague Jennifer Fabrini. We're going to be supporting you for today's topic. I want to go over some housekeeping rules real quickly. If you're having any audio trouble or having difficulty hearing us, please join the webinar via phone. Click on the audio and then click on the phone icon and follow the dial-in instructions. And for questions, comments, or anything related to today's topic, please include it in the questions / chat box. We'd appreciate that. Raise your hand if you have a question. All lines are muted, so the questions box, as I stated, just remember to submit the questions, your ideas, your comments in there. And then we're going to hold off on the questions until after the presentation. The presenters are going to allow us to kind of, at that point, we'll share the questions coming from you to our presenters. So our goals, dedicated time for housing providers, sharing questions and strategies and resources, working towards solutions and common understanding. All Chicago will continue to explore additional topics until June 25th at this time. So please remember to join us, and you can use the same login information, and we will continue to build and explore solutions and increase common understanding as we continue to go throughout the month. So today's topics, we're going to have our presenters are going to present on children and COVID-19 from the Illinois chapter of the American Academy of Pediatrics. And then after that, we're going to have the wrap up. And so what I would like to do is pass the information over to our presenters so they can introduce themselves.
Hello, everyone. Thank you for having us today. I'm Karen Louie, and I'm here with Laura Pabalon and Deanna Barron. We're all pediatricians in the Chicagoland area and are here to talk to you about how COVID-19 has affected children. Next slide, please. Thanks. We first wanted to share some data from Illinois that was published by the American Academy of Pediatrics. As of June 4th, there were just over 84,000 confirmed pediatric COVID-19 cases, which means that about 5% of the cases have been in children, and only about 0.3% of children in Illinois have tested positive for COVID-19. That said, many of the kids have not been tested. And then children were less than about 3.5% of the reported COVID-19 hospitalizations, and were less than 1% of the reported COVID-19 deaths. So when it comes to kids, we can be reassured by this data. Next slide. So how do we stay safe? I know that we've all heard a lot of this over and over again, but it certainly stands true. One of the most important things to do is to wash your hands with soap and water for at least 20 seconds. And we like to tell the kids to either sing the ABC song or sing the happy birthday song twice. Another important thing is to social distance at least 6 feet from others when possible. We know this can be challenging, especially in congregate settings though. So especially in this case, we want to make sure that everyone knows to cover their noses and their mouths with a close-knit cloth mask or covering. This stands true for kids who are 2 years of age and older. And it's really important to remind the kids to not touch the front of the mask. And when you're trying to remove the mask, you want to make sure to remove it from the back. On the same note, we want to remind everyone to try not to touch their face, which we've noticed that a lot of us do. And if you do, make sure you're washing your hands before. And then make sure to clean and disinfect surfaces as often as possible. And I'm sure a lot of people have had some questions about gloves. Our recommendations are to wear gloves when you're cleaning or when you're caring for someone who's sick, but it is not recommended to wear gloves when you're doing other daily activities, such as going to the grocery store. And then when washing clothes and stuffed animals, you want to use the warmest water possible and make sure that everything is completely dry. Next slide, please. And then who is at highest risk for complications of COVID-19? Similar to adults, children with underlying, medical conditions are certainly at higher risk for complications. Things like heart disease and then lung disease, including asthma, and then conditions that can weaken your immune system, so kids who've had any sort of transplant or who have cancer or sickle cell disease. children who are dependent on medical technology like ventilators or who have tracheostomies are at higher risk. Also, people with obesity have had higher rates of complications related to COVID. We always worry about children who are less than a year of age and pregnant women in their second and third trimesters. Next slide, please. So the symptoms to look out for COVID-19 are fever, chills, runny nose, cough, sore throat, difficulty breathing, body aches, loss of smell or taste, headaches, nausea or vomiting, and diarrhea. Next slide. So what do we do if a child is sick? So the first thing to do is to make sure that the child is safe. If you notice any shortness of breath, any blue around their lips, any sort of severe persistent chest pain, any sort of mental status change like confusion or the inability to stay awake, it's important to call 911 or to go to the nearest emergency room. If this is not the case and the child is stable, we recommend that you call the child's primary care provider. That way you can get a little information about whether or not the child should go into the clinic to be evaluated or if the child just needs a test. For most shelters, we have partnerships linked with the clinics, and we can determine whether or not we can provide COVID-19 testing at the shelter itself. If not, you can call Lawndale Christian. They have a COVID-19 mobile testing unit, and we provided the number there. Next slide, please. And now what do we do if a resident or a staff member tests positive for COVID-19? There is a link on the Chicago Department of Public Health website, and you can submit the form with some information that's listed. And then once you've submitted it, CDPH will reach out to determine how the shelter is going to get tested and how to isolate the positive individuals. Next slide. So after residents complete their isolation period, it's especially important that they wear a mask because viral shedding can occur for weeks after the symptoms resolve. And then all the other precautions that we discussed earlier will be important. Next slide. For staff, we know that this has been particularly anxiety-provoking, which makes sense. Everyone wants to keep their families healthy. The most important thing to do is to perform good hand hygiene. Some of the healthcare providers have been doing some things such as removing their clothes at work and changing to something new before going home, or taking off their clothes and washing them immediately or getting into the shower immediately. You certainly can do that. There just isn't much evidence right now that these are effective. Next slide. Good. I'm going to hand it over to Dr. Papillon.
Okay, so like Karen talked about, I mean, while physical distance is important to prevent the spread of COVID-19 infection, it is still very, very important for children to keep their well-child checks, well-child checks meaning checkups. So the American Academy of Pediatrics recommends keeping the normal well-child visit schedule. One of the more important things of a checkup are the vaccines, and we definitely want to keep children on track with their vaccines so that we don't, cause another outbreak from a vaccine preventable illness such as measles. All clinics and hospitals have made changes to keep patients safe, to keep the sick kids away from the healthy kids, and keep everything sanitized. So parents can call the doctor's office to ask about any of those changes, including telehealth visits, which a lot of practices have started to do through video. Next slide. So these are just some tips on how to talk to children about COVID-19. It's important to, I know we're all anxious, try to remain calm when talking about the subject because children really react to not only what you're saying, but how you're saying it. Try to reassure children that they are safe, but let them know it's okay to express their emotions. Try to talk to them about their emotions. Maybe talk about how you deal with your own stress so that they can learn from you on how to cope with stress. One idea is to switch negative language to positive language. So for example, if a child is saying, I'm worried about getting sick, try to flip that into them saying, I'm going to stay well. Make yourself available to listen and talk, and try to avoid any language that might blame others for the pandemic and lead to stigma. Next slide. Also try to provide truthful and age-appropriate information. So I'll get to some resources in a second, but the older kids that use social media, try to monitor their use. Obviously, we know that not everything on social media is true, and try to discuss what they're seeing on the internet. As Karen talked about, teaching them how to prevent or reduce the spread of germs. For little kids, kind of the vampire move of having them cough or sneeze into their elbow and staying away from people who are sick. And then really, really important to keep, as best you can, to their normal routines. Obviously, some things that they normally do, you can't do still, but as best you can, try to keep a schedule, because children really respond to stability. Next slide. So I think we had some questions on how to best have kids wear masks. Again, this is for 2 and up. Less than 2, they don't need to be wearing masks, and it can be a choking hazard. So having them look in the mirror with their mask on and talking about it, putting a mask on one of their favorite stuffed animals or drawing one on a character that they really like, decorating the mask so they're more personalized, and then showing pictures of other children wearing masks, which I think we have a resource in the next slide. The next slide, please. So the next 2 slides are just some helpful handouts. There are actually a lot of resources online for COVID and children. The first one is a coloring book. The second one is a great resource for that specific, like the children that have a difficult time keeping masks on, and has pictures of other kids wearing masks. The COVID time capsule is actually pretty fun, I think, for older kids. It kind of makes them kind of jot down their experience during COVID-19 so that they can look back on it in the future. Chicago Parent Program has some nice resources on how to talk to children about COVID-19. Next slide. Just some more resources, and the last 2 are just kind of nice free resources. Audible has some stories for children that are free. Headspace, you might have heard of, is kind of a meditation and movement mindfulness program. So they have a lot of exercises that people can do that are also free. Next slide. Okay, so I'm going to hand it over to Deanna now.
Hi, I was just unmuting myself there. I hope everybody can hear me okay. Thank you guys all for joining us, and I wanted to thank Dr. Louie and Dr. Pabalan for doing such a great job. So as Dr. Pabalan was talking about, some of the effects of COVID-19 on kids are not just physical, which we'll go into a little bit about in a few minutes, but also mental. So we are concerned about the mental health for kids during COVID-19. So some important warning signs for parents and caregivers and other people to be aware of for early anxiety for both younger and older kids, but particularly for younger kids, can be moodiness and crankiness. Of course, we remember that the younger kids might not have the words to express how they're feeling, and that can make them act out in a number of different ways. And each kid might act differently as well. So really it's about kids who have a change in how they normally act. So if they're more moody or cranky, that could be crying out for attention. Same thing with being more clingy. If they are having sleep issues, if they seem distracted all the time. And then there are some physical manifestations that kids, again, they might not know how to articulate what they're feeling. So it might come across as stomach aches or headaches or some other things that they might not know how to describe, but you know, that pit in your feeling when you feel anxious, that might be something that they get as well. So for some of these things, if you notice a young child acting this way, one of the things that you can do is call your pediatrician, and your pediatrician might have some resources to either help see the kid or help screen the child to see if they might qualify or they might need some help coping with a really difficult time that's going on right now. Next slide, please. So some warning signs in teens. So some of them are similar to the younger kids, but of course, the teenagers also have a lot of other things going on in their life. So same things about the moodiness and the irritability, but watch how they're interacting with their friends and their siblings. Sometimes they may actually be less interested in talking to friends or in participating in hobbies. And this can be because they are experiencing something like depression. It could be because they are anxious about everything that's going on and they feel like they don't want to invest in some of these relationships or some of these hobbies that they had previously enjoyed. Changes in sleep can both cause and result from anxiety and depression. So if you have somebody who is a depressed person, they might have problems sleeping, which might cause them to sleep at odd times. Or if you already have problems sleeping and they're staying up at night because they're worried about things or because they don't have the same schedule that they might have, this can lead to them having problems during the day, because we know from research that kids need quite a lot of sleep. And if they don't get that, they're not going to be functioning at their best. Similarly, changes in their appetite and or weight. So sometimes in this era, kids don't feel like they can control all that much. So either consciously or unconsciously, that might manifest itself in how they are feeling and how they're eating. And weight and food intake can be one of the few things that they have control of over this time. And so they might be eating a lot more, or they might be eating a lot less. That's a way for them to exert some kinds of control. Or it could just be a function, again, of having depression or anxiety, because both of those things can cause changes in your appetite and or your weight. And of course, that kind of ties in with above, but they can have images with, concerns with their body image as well. Poor concentration and forgetfulness can tie in with all of these. Worsening school performance. So of course we realize that school is kind of up in the air right now, and that for virtually every child, except for those who might have already been homeschooled, their school environment was radically different from what they were used to. So it's a little bit difficult to see here, but if you had a child who was previously interested and engaged, who is now pulling back and not interested in school, that's a warning sign. Cutting is a behavior that we sometimes see, and that's a way to relieve psychological pain through a physical method. So that is something that's not an uncommon way to express themselves. And then also an increase in risky behaviors such as drugs and alcohol. And of course, in patients who are also housing insecure or homeless, they might act out in this way. So this might be something that providers in clinics or providers in shelters might see, but we could see this in any child. Next slide, please. So what can parents or other caretakers or staff members at some of the shelters do? So it's important to keep communications open. So ask how your kids are feeling and share how you are feeling. And as Dr. Pavlon said, to say that, try to express things in a positive rather than a negative way. Another thing, we don't necessarily have this specifically on here, but something else that you can do is, again, to call your pediatrician's office. Sometimes they can do a telehealth screen, or they can provide some resources to help cope. Try to maintain some routines. So kids in general are creatures of routine and they crave that structure. So things that are familiar to them are likely to help them maintain some sense of normalcy. So it's important to try to maintain routines. And of course, we understand that in the middle of a pandemic, and especially in kids who are in housing insecure families or in an unstable housing situation, they might not be able to maintain those routines. So developing new routines might also be beneficial for that kid, and it might not be something that's scheduled every day down to the minute, but having something that they can cling to as a sense of normalcy is important if possible. Try to schedule some downtime if possible. So as much as possible, if there's any activities that the kid enjoys or the family usually enjoys, to try to do those things. If they're able to, or and they have space and privacy, they can try some meditation or stretching. And pretty much anybody can do meditation, I suppose, and also some of the deep breath exercises. So there's a lot of resources for ways to do that. And then schedule time with friends and time with family, and schedule time for exercise if it's possible to do in a safe way. It might be difficult for kids to have access to some of the formal exercise equipment, and depending on what area they're in or what their situation is, it may be difficult to exercise outside. And then bedtime routine. So for the younger kids, at least, you can establish a bedtime routine such as brush your teeth, read a story, name one thing that one favorite thing that you did today, name something that you're grateful for. And that's a way of developing some of these some of these schedules and routines. And then again, if they are, if you notice any or multiple signs that we mentioned before, please don't ignore them. Don't minimize feelings of sadness, threats of self-harm or suicide, particularly if you have threats of self-harm, threats of harm to others, or suicide. Seek professional help immediately. And that might be with one of the shelters, one of the clinics that are associated with the shelters, or it might be their own private pediatrician, depending on what the child's housing situation is. And then also just to recognize that this is a difficult time for kids. So this is kind of going back to the first one, but recognizing for them that their whole life has changed, even if briefly, but a lot of things are different in their life, and talk to them about how they're feeling about that. So next page, please. So here are some mental health resources that can be shared with children and people who are taking care of children. So the National Alliance on Mental Health is offering virtual support groups, which is really important. I know at my hospital, we are able to have our psychologist or child psychiatrist do telehealth visits with children, even if they're in the intensive care unit or on the floor. And children can also participate in some of these group activities, so that can be really helpful to maintaining a child's mental health during this time. The SAM HSA, so Substance Abuse and Mental Health Services Administration, and then No Shame on You, and there's a specific Chicagoland organization, so noshameonyou.org/Chicagoland. Next slide, please. And then if they are in crisis, so if you think that they are acutely in crisis, in danger of hurting somebody else, in danger of hurting themselves, or in danger of a suicide attempt or suicide, these are some helpful hotlines. So the National Suicide Prevention Lifeline, the crisis text line, so that can be helpful, especially if they are in a place where they don't have a lot of privacy to speak on the phone, and especially for this generation who might not speak on the phone as much as some of us. So they can text NAMI to 741-741 and try to get some help that way. And then the CARES or SAS has that 1-800 number listed here as well. Next slide, please. So this is something that we worry about a lot during the COVID pandemic. So there are some indications that kids are attempting to commit or committing suicide at higher rates during the pandemic than in normal times. That's not I haven't seen any formal research on this as yet, but there are some suggestions that this is something that might be happening, and at the very least, it's something that we are worried about. So healthychildren.org is a website run through the American Academy of Pediatrics that helps parents and other healthcare providers or other providers and carers for children help care for kids. So word about suicide risk in teens. So some things that are very important. So if you are worried about your teen, kids are impulsive, and so it's important to remove anything that they could use immediately. So to make your safe space, make your space safe. So removing things that can be used as weapons. If the household has a gun, it should be stored in a locked position, so stored with a gun lock, and ammunition should be stored in a separate locked box. And particularly if you have a child who you think, or a teenager who you think is at risk for suicide, we strongly recommend this. But also securing things like medications in a locked box or other things that you think might be able to turn into weapons, and try to keep that out of their hands and prevent them from taking an impulsive measure. So we do know that if you prevent a child from committing suicide, from the act of attempting suicide, the chances that they will try again are not as high as you might think. So you might save a life by doing something like that. And then seeking immediate help by calling the National Suicide Prevention Line, or again, texting TALK to 741-741 is important. And then if you are extremely concerned about the immediate health of a child, or if you're concerned about the potential for them to commit suicide or harm somebody else, you can call 911 if it is an immediate urgent crisis situation. If it is a non-crisis situation and you just notice some of those things that we were talking about before, it's appropriate to call your pediatrician and talk through some of the concerns that you're having about your teen's mental health. Next page, please. So this is a little bit of a segue, but we wanted to touch briefly on this new Misc C syndrome that has been seen in kids post-COVID. So a lot of people have questions about this, what it is, how to treat it, how to recognize it. So the first thing that I want to say is that, as Dr. Louie was saying at the very beginning, serious health consequences of COVID in children thankfully remain relatively rare. However, we do see this. It has happened. It has happened in Chicago and in places in the Chicago area. My hospital has seen a couple of these, and that's not a HIPAA violation because one of them was actually in the news and they talked about it then. So from what we have seen, and first, sorry, let me back up for just a second, that you might have seen several different names for this. So it's such a new thing that we're still really trying to get the verbiage in place so that we are able to talk about the same thing. So you might have heard it referred to other things in the past, such as pediatric multisystem inflammatory syndrome or pediatric inflammatory multisystem things. So some of the acronyms that were being used were PIMS, PMIS, PIMS, STS, and a couple of others. More recently, we've been using this Misc C, so multisystem inflammatory syndrome in children. So again, it's a rare condition. It is unusual because the peak, or when we started to see cases with this Misc C started to occur about 4 weeks later after the start of the COVID-19 syndrome. So it doesn't seem like it was an immediate thing. And it might be that it takes some time if the child was exposed to COVID-19 for their immune system to mount this kind of a severe response to COVID-19. But we are still learning about that every day. So these kids often look sick. So you could look at them and say, this child needs medical attention. Some things that they might look for, or they might look like they might have a high heart rate, or say that they're having palpitations. They might look pale or sweaty, or some of the other things we're going to talk about on the next slide, and they might need hospitalization. So again, we want to reiterate that we are still in the process of learning about this. We have national registries that we put patients on if we are concerned about this in a de-identified way. And as we know more, we will release more to the public, but we want to be careful that this is an evolving disease. And so let me rephrase that we are understanding of this disease is evolving. And so we might be learning more and new things as it comes along. Next slide, please. So some of the symptoms that we might see, so we might see fever. So fever is very common in these children and it might be cyclical. They might have GI symptoms, meaning abdominal pain, diarrhea, vomiting. A lot of these are very non-specific changes, as you can see, but the constellation of them together will point to a child who looks ill. So some of them have a rash. They might be more tired than usual. They might have headache or confusion. When we say mental status changes, what we mean is that they might not know where they are, what year it is, what their name is. They might not be acting like themselves. So that's what we mean by that. They might have what looks like bloodshot eyes, and that might be in one or both eyes, but it's something that would be unusual. Sometimes they have neck pain, and if we feel their neck, sometimes as physicians or as mom and dad, you can feel that there's some little kind of lumps, which we call lymph nodes. They might have some some increased lymph nodes, and they might have a cough. Now, they don't have to have all of these to have the Misc C syndrome, but a constellation of several of these makes it more likely. So they don't have to have fever and GI symptoms and a rash and fatigue and all these other things, but they will have some of a combination of them. Next slide, please. So for treatment, just very briefly, we are engaging in research related to the best treatment for this. And in the meantime, while they're hospitalized, they'll have a team of doctors caring for them, such as the infectious disease people, doctors who specialize in taking care of kids in the hospital, like pediatric hospitalists or pediatric intensive care doctors. And then if they have other symptoms, they might have other members of the healthcare team taking care of them. And for more resources, you can look for the CDC, the Illinois Department of Public Health, the Chicago Department of Public Health, the Chicago Health Alert Network, Healthy Children, which is that offshoot, or not offshoot, but which is that part of American Academy of Pediatrics that I told you about. And then AAP, which is the American Academy of Pediatrics, also has some state level data. So if you go to this website and click on it, you can find information for children specifically to Illinois, because of course different states are having different effects of the crisis. And then the National Alliance on Mental Health, that's what we had talked about earlier, and that's at namichicago.org. Next slide. I think that might be the last slide. So, okay. Before we go to the future topics and next sessions, we wanted to open it up for questions from the audience. And we wanted to say we really appreciated everybody who came and listened to us speak about how COVID is affecting children. And please let us know if you have any questions or anything that we can do to help you guys.
Okay, so thank you, presenters. Really appreciate you coming and sharing on this topic today. We really appreciate it. I do have a question I wanted to share with you. It actually has two parts. So the first part is, what if the parent wants their child to speak with a counselor over the phone? And then the second part is special line that they could call for in the moment of support.
Sure, so that's a great question. As far as a special line, so there are children who are doing counseling sessions either over the phone. There's even some neat systems that are set up to do it via text, or they can do video counseling through telehealth resources like Zoom or even FaceTime. And I think that there are a lot of kids out there who are connecting with their therapists in that way. Dr. Louie or Dr. Pavlon, do you have any other advice?
No, we are definitely having a lot of our patients seeing the psychologist or therapist through either telephone visits or video visits, which has been really nice. I think everybody is like that. It's been going on for the last 3 months, so those are definitely available. I can't remember the second question.
The second part is there a special line that they could call for in the moment for support?
If it's in the crisis, I would use those crisis numbers and resources. But if it's not, I would probably, if they do have a pediatrician, touch base with them because they might be know the latest in terms of wait lists, and if they need a psychologist versus a psychiatrist would be one that might prescribe medications depending on how severe their symptoms are. If they don't have a pediatrician, if they do have a clinic that the shelter partners with, I would touch base with that healthcare provider.
Okay. All right.
No Shame on You has a huge list of mental health clinics, which was pretty impressive. And you can just go look on there and see which sites might be most convenient for you, and you can call them.
So is there any more questions? I'm just giving the attendees giving our audience a couple of minutes to see if there's any additional questions that they would like to pose. A lot of wealth of resources that you shared today in all areas, to help show support. And I'm just waiting to see if we have a couple of minutes, if we have additional people that's in the audience that had questions that wanted to kind of share a little bit. See anything at the moment. Yeah. So I'll just go in real quickly about future topics. Oh, we got someone that may have raised their hand that had a question. So let's see if they actually plugged inside the actual queue. Let me see. All right. Okay. Nope, nothing at the moment. I just wanted to share with everyone for next week's topic. We're exploring a topic, so I'll send a follow-up. If there's any additional information that the presenters have that you would like to share with the community who are on today's call, if you want to send that to me, it'd be great. I'm going to make sure we share this PowerPoint. It had a wealth of information and resources in there to assist. So we appreciate that. And of course, next week we have another topic that we're going to explore. If anyone has any opportunities to share on potential topic opportunities, we're going to be going into the 25th to the end of the month. So we just want to encourage you to send that information to me directly. I'd appreciate that. I don't see any additional questions coming from the audience today. I think you and your team covered everything, but if there's any additional questions or ideas or feedback, of course, you know how to reach me at twinbush@allchicago.org. So we appreciate that. So I think we're probably going to get a little bit of our time back today. We normally end right at 3:30, unless there's some additional information that the doctors would like to share with the community at this time.
No, we appreciate that everybody came in and listened to us for a while, talk about how COVID is affecting children. And we know that in this particular environment with housing insecurity or homelessness, that the effects can be amplified. So if you guys have any questions or any ways in which we can help you or the pediatric community can help you, please let us know. Our emails, our names, I suppose, are on there, or if Torlin wants, if you are able to email him and he can send us information, please let us know.
Definitely, I'll include all that information in the follow-up communication with the slides. Of course, we like to put things inside the LMS, but absolutely, we'll make sure that the audience has that information so that they can reach out to you.
Thank you so much for having us.
So thank all of you for joining us today. I'm going to give you a little bit back of your time, and then we're going to explore another topic on next week. So thank you so much, and have a good rest of your day.
Thank
Thanks so
you.
much. You too.
Bye.
Bye.
Bye.